I'm Dr. David Levine, and I coordinate the rehabilitation services at VCSG. So the rehabilitation and also sports medicine service at VCSG really works with just about any type of patient, from high-level athletes to patients recovering from surgery, to older patients with arthritis, to patients in the intensive care unit. Kind of similar to the human physical therapy and rehabilitation world, it's really about helping our patients achieve maximal function. In terms of similarities and differences, I know a lot of people have undergone physical therapy for conditions over the years, and it's pretty similar. A lot of the physical therapy and rehabilitation that we employ in the veterinary community is pretty similar to the human world in terms of exercise prescription or aquatic therapy, home exercise programs, tailored exercise prescription for that particular animal. Maybe it's had a complex fracture repair and we really have to limit what it does, but we also need to get it strengthened at the same time. Dogs with neurological disease, maybe a disc herniation. Again, it's kind of a very specific plan for not only where that patient is, but for the needs of that patient. Are they just going to go home and be, a house pet and live a good life? Or do we have a dog that has a tendonitis in the shoulder that the owner really wants to return to agility? So it really runs the gamut, but really has a lot of parallels to the human world. Some of the things that we offer at VCSG from a rehab and sports medicine perspective that are really unique is we do a lot of wheelchair fitting. We do fabrication of orthoses or braces that are custom for dogs with orthopedic or neurologic injury. In talking to one of the wheelchair companies, we were one of their biggest clients in the country in terms of how many wheelchairs we fit for dogs that are paralyzed. We also use a lot of kind of cutting edge technology, extracorporeal shockwave therapy, or shockwave therapy as most people call it. We use some therapeutic lasers. We have aquatic therapy, not only an underwater treadmill, but a pool for conditioning and allowing dogs to recover in that buoyant atmosphere. We also have a great staff. We have multiple people that are trained in canine rehabilitation on staff here, and it's a real team approach in how we work with the surgeons and other veterinarians that are seeking some rehab care for their animal. It's really a very integrated approach. So I think one thing that we do really well is collaborative teamwork between all the services to optimize not only diagnosis and treatment, but the patient's full recovery, and working with the client as well on how to optimize their pet's health at home. So it could be anything from surgery, working with rehab, or it could be integrating nutrition or internal medicine. It's everything is under one roof, so the communication is really easy, and it's almost every hour we probably grab somebody to say, hey, would you take a look at this case with me? So I think that collaboration is really at its optimal at VCSG, where we can just grab somebody to look at a case. We have a lot of certified specialists that can lend another expert opinion and really help to make the best decision for that patient. So I have the opportunity to collaborate with a lot of veterinary colleges and universities. Actually, of course, I'm on faculty at University of Tennessee, but I'll be at NC State for the next 6 days, working up there and teaching. And I do get to go around the country and the world, lecturing and being involved in this area of veterinary medicine. And I think VCSG has kind of a very unique clinical situation and approach, where we are in a lot of ways like a small vet school. We have so many specialties here, so many experts that work well together just to optimize the health of every single patient. In rehabilitation and physical therapy, within this specialty, we also spend a lot of time on owner education. So it's not, here's a piece of paper, these are exercises to do at home. It's finding out, what an owner is capable of doing, obviously knowing what that patient is capable of doing, and then, figuring out an optimal plan for how to implement something at home where you may not have a lot of equipment. And so, that is a big part of what we do, is translating what we do in the clinic to what people then have to do at home to optimize function. So we spend a lot of time on owner education, And when owners come in and we talk about how they're doing, a lot of it is just listening and seeing how things are going, what we can adapt. And that's a big aspect, just that listening to people. Yeah, so we're excited about the new space because we're going to have a larger area, of course, but also a designated wet area where we have the underwater treadmill and also a swimming pool, which really allows patients to train in different environments where there's not as much stress on their joints. And it's also used for fitness and wellness. That is an aspect. You're conditioning a hunting dog before season, or you're just trying to get an animal that is maybe a dog that's in lure coursing and they've had an injury, and you're trying to kind of get them back to that, get them back to where they were physically before an injury. We also see patients at times just for weight loss programs, where they might come in, even dropped off in the morning, picked up at the end of the day, and they can have multiple sessions. That extra space does allow more drop-off patients. So there are patients that may only be able to tolerate maybe 10 minutes of exercise. But if a patient's dropped off and we have the room for that now, they could get 4 or 5 10-minute exercises, exercise bouts throughout the day, rather than an owner just coming and dropping them. And it allows us to progress that patient more quickly.